My fellow South Africans, on Tuesday, the government chose to extend the state of disaster yet again. South Africa has now been under a state of disaster for over 2 years. All signs are that the government will continue to extend the state of disaster until it has permanent legislation that can keep the lockdown in place. This week, the Health Minister released a raft of proposed changes to health regulations to enable the lockdown to continue after the state of disaster ends. And yesterday, the Labour Minister published a new code of conduct for managing COVID in the workplace. Let's be clear about what all of this means. It means that South Africa will be under a state of disaster indefinitely, and that the lockdown is now becoming permanent. Over the past 2 years, this government has constantly claimed to be led by the science. The science now tells us that the lockdown is unnecessary, irrational, and unreasonable. Yet this government is intent on keeping the state of disaster and the lockdown. When the president proudly states that his government's COVID response is guided by science, he should be honest to admit that this is only true when it enables more sweeping, unchecked powers for his government. Because when the science points in the other direction, as it is very clearly doing now, his government pretends not to see or hear it. Next Wednesday will mark 2 years since South Africa entered a 3-week lockdown to prepare our country for the COVID-19 epidemic. Since then, hundreds of thousands of people have lost their jobs. Thousands of livelihoods have been destroyed, and millions of school and university days have been missed, and billions of rands have been stolen and lost to tax revenue. This money could have gone directly to poverty relief. The only state of disaster that the country is in is the self-imposed one caused by these ongoing restrictions, which do far more harm than good. It is time to focus all of our country's energies on regaining and transcending what has been lost. And, importantly, it is high time to restore our democratic order. The Democratic Alliance, as the official opposition, will not allow the state of disaster to just be glibly extended now month after month. We will stop it, and we will stop it in court. We will not allow our democracy to be suspended indefinitely in favor of rule by government decree with no democratic checks or balances. I can therefore announce that I have today instructed our attorneys to bring an urgent court challenge to Tuesday's irrational and unreasonable extension of the state of disaster. It is urgent because we cannot be in the state of disaster for another day. But it's not enough just to end the state of disaster. The lockdown itself must end. It can't just become entrenched in permanent legislation, as this government is now trying to do. When the government moves lockdown regulations into permanent legislation instead, I want to give the citizens of South Africa the assurance that the DA will mount a legal challenge to those attempts to usurp our democracy as well. The lockdown is not in South Africa's best interest. On the contrary, it's pushing more and more people into joblessness and deeper into poverty. Let's be clear. The real disaster facing our country is our growing poverty and jobs crisis. And this crisis poses a far higher risk to national well-being and is causing far more suffering than COVID is. As a nation, we must get better at assessing and balancing risks. Government's over-caution on COVID is exacting a profound human toll, and it's measured in joblessness, hunger, desperation, and despair. This is the human toll that we must balance against the COVID risk. A risk, if we're honest, which has been extremely low for some time now. Severe COVID illness and hospitalization rates are incredibly low across the country. Transmission rates are also extremely low. And even if they do go up, they won't necessarily drive severe illness and hospitalization rates with them. The fourth COVID wave in December 2021 was not associated with a significant hospital pressure. And despite the fourth wave, there have been almost no additional deaths in people under 60 since early September 2021, except for 1 week over Christmas. Older people were also less seriously affected than in previous waves. This is because most people in the high-risk group have protection against severe disease and death, either from vaccines or from prior infection, or in some cases, both. This lockdown is of little to zero benefit to society. Cases of COVID-19 are not a disaster if people are not getting very sick nor dying. And this is why many other countries have opened up their economies even with high cases. There is absolutely no need to maintain the state of disaster and the lockdown. The reality is that if needed, the state of disaster and the lockdown can always be reinstated if the situation genuinely demands it. And we've already seen how quickly that can happen. There's also absolutely no need to move lockdown restrictions that have damaged our economy into permanent legislation. As I said, if the COVID risk goes up, the state of disaster can always be reinstated at that time. The only permanent COVID-related regulations that need to be in place are those enabling the social relief of distress grant to continue to be paid, precisely because of the damage that has been done by government's heavy-handed response that have driven people into poverty and hunger. On the other hand, the single most immediate step that South Africa can take to reduce the overall risk we face as a society is to end the state of disaster and the lockdown altogether. No other step will do more to address our poverty and jobs crisis. No other step will do more to speed up service delivery to the poor. And no other step will do more to safeguard our democracy. Ending lockdown will have a major positive impact on our economy. Now, level 1 and other ministry-specific restrictions may seem harmless, but they are not. The tourism industry, by example, used to support 10% of all jobs in South Africa. Yet, international tourism is still only 20% of what it was. Its recovery is being hamstrung by requirements such as negative PCR tests to enter the country, imposing a significant additional cost to international tourists. Most countries now accept evidence of vaccination or prior infection, while some, such as Mexico, impose absolutely no requirements at all. While the rest of the world has filled stadiums for sport and shows, which also attract tourists, in South Africa, the Soweto Derby had to take place in an empty stadium last weekend. Outdoor and indoor limits of 2,000 and 1,000 prevent the events industry from reviving itself. Most of the world has also opened up its nightclub and nightlife, particularly to attract tourists. But South Africa still bans nightclubs from operating. Given this, it is little wonder that more than half of adults in South Africa are now not in employment. No wonder our economy is simply not recovering, and no wonder people are falling deeper and deeper into poverty. Rotational schooling has thankfully come to an end after the DA filed papers in court the last time. But social distancing and rules contained in Level 1 regulations still apply to all employers, including state departments and agencies, municipalities, universities, and banks. This means that many places are still operating on reduced or rotational staff with lowered productivity all round. It also means that employees with comorbidities are still working from home, even if the nature of their job actually requires contact with the public. Our citizens are wasting time in queues and waiting for government services. And as usual, this is affecting the poor disproportionately, as the poor rely far more heavily on government services. Tertiary institutions are still operating in a hybrid fashion, with negative effect on particularly poorer students for whom online options are either not ideal nor available. Some police stations and other government offices still close for extended periods for expensive and unnecessary sanitizing whenever a single COVID-19 case occurs. This is massively wasteful expenditure. In South Africa, it is still the law to wear masks in public, including in schools where they are a major barrier to learning and a source of great discomfort. In most countries, masks are now only mandated in specific high-risk contexts. The requirement to wear masks outdoors is particularly irrational. It's time to treat COVID-19 in the same way as we treat other health risks facing us, such as HIV and AIDS, TB, cancer, and maternal mortality. Like other countries, we need to focus on vaccinating the high-risk group. Like other countries, we need to license cheap and quick rapid tests for home use so that our people can judge for themselves if they pose a risk to the vulnerable. It makes no sense whatsoever to limit these to medical supervision. And like other countries, masks should only be mandated in high-risk contexts, such as an oncology ward. And like other countries, we should be doing everything possible to stimulate our economy toward the return of jobs. Instead, this government is planning to make some of these and other restrictions permanent by legislating them. They want to make them the law going forward. And this is going to continue to strangle our economy, harm young people in education, and expand poverty. As I've said, the only part of the disaster regulations that should stay in place is the social relief of distress grant, precisely because of the jobs crisis created by government's poor policy choices and their heavy-handed approach to the COVID-19 pandemic. Apart from that social relief grant, nothing else is justified. But let's be very clear about what is really going on here. This ANC government is no longer fighting the spread of COVID. It is fighting to hold on to the powers it has become accustomed to these past 2 years. Powers that allow it to evade all accountability and oversight. Such an unconstitutional power grab cannot be tolerated in an open democratic society like ours. And it's time for our citizens to stand together and speak out about it. The Democratic Alliance is going to fight the state of disaster and the lockdown until we end them both. And we urge you to stand with us. If President Ramaphosa does not instruct his poverty cabinet to end both, we are going to see him in court. And we are going to return our democracy back to the hands of the people where it belongs. Thank you very much.